Rhinoplasty is usually done at the age of 16 years until the nose is fully grown. Cleft palate is repaired around after 1 to half year. Pierre-Robin syndrome is cleft palate with mandibular hypoplasia and respiratory obstruction. Commonest type of cleft lip is combined with cleft palate. Rhytidectomy operation involves removal of wrinkles in forehead. In cleft lip operation, all the stitches are removed on fourth day. Unilateral cleft are most common on left side. The following is the method for operating cleft lip except Wardell's method. So which are the methods for operating cleft lip? Lee Mesurier's method, Tennyson's method and Millard's method. Cleft lip is due to non-fusion of maxillary process with medial nasal process. Unilateral cleft lip is associated with posterior displacement of alar cartilage. Pierre-Robin sequence includes glossoptosis, airway obstruction, and heart anomaly. With respect to surgical repair of cleft palate, the soft palate is first repaired. Ideal time for which is 6 months. A 4-month-old baby has cleft lip and palate. How would you manage the baby? Immediate repair of the lip. True about cleft palate. Surgery should be done at 1 year, associated with the hearing loss and associated with cleft lip in 45%. Maxillofacial injuries. Mandible is commonly fractured at the neck of the condyle. Lee 42 facial fracture implies similar to C but on both sides. A 20-year-old man is hit on the eye with a ball. On examination, there is a restriction of lateral and upward gaze and diplopia. There is no obvious visible sign of injury to the eyeball, but there is some anophthalmos. The likely diagnosis is blowout fracture of the orbit. Best treatment of this condition will be explore the orbit. Fracture mandible with edentulous jaw is best treated with external fixator. Best view for mandible is orthopentomogram, which is the most common type of skull fracture, linear fracture. Oral cavity, commonest site of carcinoma tongue is lateral border. Dentigenous cyst arises from an unerupted tooth. Carcinoma tongue less than 2 cm is treated by excision. Treatment of choice for carcinoma of lips of less than 1 cm is excision. Predisposing factor for developmental of oral carcinoma is smoking, alcohol and syphilis. A full thickness loss of middle one-third of the upper lip is best reconstructed by Abbey flap and Aslander's flap. A patient with cheek cancer has a tumor of 2.5 cm located close to and involving the lower alveolus. A single mobile homolateral lymph node measuring 6 cm is palpable. The TNM stage is none of these. In the reconstruction following excision of previously irradiated cheek cancer, the flap will be pectoralis major myocutaneous. Commonest site of carcinoma tongue is anterior two-third lateral aspect. What is ranula? It is a retention cyst of sublingual gland. Commonest type of oral malignancy is squamous cell carcinoma, which is not true of carcinoma tongue. Commonly adenocarcinoma is false. What is true is lateral border is involved, cervical lymph node involvement, and tobacco chewing is a risk factor. Painless ulcer of the tongue is due to syphilis. Commonest pre-malignant condition of oral cancer is leukoplakia. Most common type of oral carcinoma is lip. Lymphatic metastasis of buccal carcinoma first involves submandibular nodes. Anatomical structure injured in excision of ranula, submandibular duct. Not a carcinogenic for cancer of head and neck. Unfluorinated water. 60-year-old man present with an ulcer on lateral margin of tongue also complains of ear pain. Most probable diagnosis is carcinomatous ulcer. Cancrum oris, all are true except none of these. So all are true. Cancrum oris is associated with malnutrition. It is an inflammatory swelling associated with vitamin deficiency. Treatment is excision and skin grafting. Patient with T3N2AM N2M0 lower alveolar carcinoma requires surgery. Trismus in oral cancer patient is severe in whom was treated with surgery and radiotherapy. Impacted wisdom tooth may produce referred pain via branch of the auriculotemporal nerve. Areas of carcinoma of oral mucosa can be identified by staining with 2% toluidine blue. Carcinoma of the tongue occurs most commonly on the lateral border of the middle third of tongue. Metastasized readily to cervical lymph node, it is usually radiosensitive. It is treated surgically, should include homolateral neck dissection except for very small lesion. All are true about cancrum aureus except it follows chronic infection is false. What is true about cancrum aureus? It is associated with malnutrition and vitamin deficiency. It involves jaw and treatment is excision and grafting with tubed pedicle graft. Gum tumor with two contralateral mobile lymph node in cheek comes under T4N2M0 and T2N2M0. Epulis arises from gingiva. All predisposes to oral cancer except lichen planus. Erythroplakia, leukoplakia, and submucosal fibrosis predispose to oral cancer. What is the true statement about oral cancer? Metastasis is common. It responds to radiotherapy. Surgery is done. Syphilis and dental irritation predisposes. Radiograph finding of floating teeth can be seen in histiocytosis X. Carcinoma of lip is characterized by the following, except that since lymph node metastases are common, after a radical dissection of neck is mandatory. So carcinoma of lip is characterized by 90% of the lip cancer occur on the lower lip. The most common site of origin is the vermilion border. 2 cm by 2 cm cell carcinoma can be treated by V-shaped excision and primary closure. What is the most frequent tooth to be impacted? Lower third molar. A 70-year male presented with asymptomatic white patch on oral cavity following application of the denture. Treatment of choice is ascertaining the denture is fit incompletely. The most common cyst of the oral region is periapical cyst. Which of the following statement is correct in case of squamous cell carcinoma of the lip? Radiotherapy is considered inappropriate treatment for these lesions. In a patient of carcinoma tongue, the infiltration of which muscle causes ankyloglossia? Genioglossus muscle. Which is not true of carcinoma tongue? Commonly, adenocarcinoma is not true. What is true is lateral border is involved, cervical lymph node involvement, and tobacco chewing is a risk factor. A middle-aged man presents with the lower jaw swelling. Clinically, there is expansion to the left ramus and the X-ray mandible shows soap bubble appearance. What is the clinical diagnosis? Adamantinoma. Which of the following statement about ranula is most correct? It is a cystic swelling in the floor of mouth. A patient presents with cheek cancer of 2.5 cm size close to and involving the alveolus with a single mobile cervical lymph node of 6 cm size. What is the TNM staging? T4N3M0. Warthin's tumor, salivary glands. Warthin's tumor is it gives a hot pertechnetate scan. The parotid duct is Stenson's duct. Sjogren syndrome refers to disease of parotid gland. Treatment of choice for mixed parotid tumor is superficial parotidectomy. Parotid tumor which spreads perineurally is adenoid cystic carcinoma. Treatment of submandibular salivary gland duct calculi is opening the duct and removal of calculus. Adenolymphoma refers to Warthin's tumor. In submandibular gland surgery, the nerve least likely to be injured is inferior alveolar nerve. Inflammatory enlargement of deep lobe of parotid gland is seen in tonsillar fossa or tonsillar bed. Mixed parotid tumor arises from epithelium and mesenchyme. Most common tumor of minor salivary gland is mucoepidermoid carcinoma. Which of the following group constitute Frey's syndrome, redness and sweating over the auriculotemporal during meal? Best treatment for pleomorphic adenoma is superficial parotidectomy. In a case of parotid swelling, the diagnostic procedure of choice is FNAC. Commonest tumor in parotid gland is pleomorphic adenoma. Stones are maximum in submandibular. Most of the parotid tumor are managed by superficial parotidectomy. During parotid surgery, injury to the nerve which results in Frey's syndrome is auriculotemporal nerve. The nerve sacrificed in parotid surgery is facial. A bacterial pyogenic parotiditis is found most commonly in which of the following? Debilitation after major surgery. Commonest site of ectopic salivary tumor is cheek. In surgery of submandibular salivary gland, nerve often involved is hypoglossal, facial and lingual. All are true for pleomorphic adenoma except none. So it arises from parotid, may turn into malignant, and minor salivary glands are involved. Mucoepidermoid carcinoma of parotid arises from secretory cells. Treatment of choice in mixed parotid tumor gland is superficial parotidectomy. True statement about salivary gland tumor is pleomorphic adenoma can arise in submandibular gland. Fraze syndrome is due to injury of auriculotemporal nerve. Which of the following statement regarding salivary neoplasm is correct? 80% of benign are pleomorphic. In which of the following condition the cyalography is contraindicated? It is contraindicated in acute parotitis, while it is indicated in ductal calculus, chronic parotitis, and recurrent cyanoadenitis. In which of the following location carcinoid tumor is most common? In small bowel. A Warthin's tumor is an adenolymphoma of parotid gland. Mixed tumor of the salivary gland are most common in parotid gland. Cyalosis refers to non-inflammatory parotid enlargement. Which of the following nerves lie closest to the Warthin's duct? Lingual. The most common tumor of the minor salivary gland is adenoid cystic carcinoma. Which of the following is not a landmark for facial nerve during parotid surgery? Inferior belly of omohyoid. All of the following are anatomical markers for localization of facial nerve during parotid surgery except inferior belly of omohyoid. So, which are the anatomical markers for localization of facial nerve during parotid surgery? Posterior belly of digastric, mastoid process, and bony external auditory meatus. Regarding pleomorphic adenoma of salivary gland, true statement is parotid gland is most commonly involved, also called as mixed tumor, and superficial parotidectomy is treatment of choice. All of the following statement about lymphoepithelioma of the parotid gland are true except parotid gland is the most common site of lymphoepithelioma in the head and neck region. So what is true about lymphoepithelioma? It is associated with Epstein-Barr virus infection. It is highly radiosensitive and it is a type of squamous cell carcinoma.